is very dear to my heart. When I was in Maiduguri in January, near the Sambisa, we went on a mission trip, on a health mission trip near the Sambisa forest. And some of the soldiers came out to talk to us because I was heading the mental health unit. And this soldier was like his whole body was like something was biting him, but nothing was biting him physically. It was stress. And he said, many of us are like this in the forest. We are almost mad. We are going mad. And that unfortunately, the government, nobody is thinking about helping us, helping our mind, because this place is turning us mad. And there's a call also that for a lot of our soldiers that are out there, there's a need to help them, offer them rehabilitation before you reintegrate them back, because the trauma of this war is unimaginable. In the developed countries, before you bring soldiers, when you bring them back, you take them through a lot of rehabilitation, biofeedback, post-traumatic stress counseling. We need all of this in order to be a healthy country. There was an article, I think in 2016, by the Commissioner of Health in Ogun State, Dr. Ikpaye, that talked about, from what they have analyzed, that over 60% of Nigerians have real mental health issues. And when I talk about mental health, for me, I even talk about everyone has mental health issues. We all experience mental health issues because we experience pain, sadness, loss, disappointment, relationship issues. Erectile dysfunction can be an emotional health issue, you know, but it is when it is not handled properly, because we all have different coping skills, that it now becomes a mental health disorder and problems. Also, genetically, some people have mental health ability to react in different ways because of what they have inherited. And so when you have a mother that has been chronically depressed and has the neurotransmitters has been used up, and there's a problem with its production, it is the same gene that the mother is going to transmit, or the father, to the child. So the child grows up, you know, is born with a predisposition to a mental health issue. You know, so all this is important. But when we have systems in place that allows people to be able to, to be able to receive care and support, then it does not have to get to a point of mental health disorder. So the reality is that mental health issue is everybody's issue. And if we deal with it, then we have a healthy issue. I said this, a person that gets out of his car because somebody hit his car and begins to box somebody else is a mental health issue. Our leaders fighting in parliament is a mental health issue. There is stress that they have not learned to manage that comes out through the hand, because there are different ways in which you express what is in the heart. Either you express it by talking to somebody in a quiet, nice way, or you express it through aggression. It's all mental health issue. The same way we are passionate and we want, even to start with, even our physical health, hospitals and all of that, it is under, you know, it is not where it ought to be. But the reality is that if we have good mental health policies, at the same time, we also make it a priority that as we are developing, we want to develop hospitals, we are looking at developing mental health services. And the good thing about mental health is that you don't need as much funding for that. You don't need big structures and big equipment to set up, to train people, just like we are doing here. We are training mental health facilitators. They are going to go into their different places of work, schools, teachers, and all of that. We don't need to give them equipment to work. And they will be able to work and, you know, help people. At the same time, we make mental health clinical. Our universities begin, you know, develop units where they give clinical training, not just guidance and counseling, so that people are able to do the clinical work as mental health. We give scholarship to people to go and get trained in mental health, and we train more mental health facilitators that can reach out on the in the grassroots and reach to people, you know, reach people that might not have access to psychologists or psychiatrists, and they are able to identify, you know, the needs and attend to it at the early stage. before it escalates. And then they're able to identify the one that has escalated and then refer. But the truth is that with mental health, we don't need much to have good mental health services.
Where we need to go from here is, I would say that we are very lucky to be participating in this seminar today. In fact, it has opened up my eyes to see the society and to see people and to look at them with more compassion and with respect, knowing very well that the things we take for granted, you know, the issue of mental health, a lot of times when people are sick, they are not ashamed to say, oh, I have a headache, oh, something is wrong with me in my arm is aching, my stomach is aching, and all of that. So we need to begin to destigmatize the issue of mental health so that people don't feel that, oh, if I say I have this issue, or if I admit that, you know, I'm not mentally stable at this moment, or sometimes we see people and we call them crazy and things like that. But with this understanding, with the knowledge we have received today, I don't see people and call them crazy. I look at them with pity. I have compassion on them. You know, I look at them like, okay, this person needs my help. This person needs love. This person needs attention. And the key thing that I am taking with me today is the matter of attention, paying attention. You see, when we pay more attention to people around us and in our society, we begin to see where people need help, where they need assistance, and then at the end of it all, we can make very good referrals. So I don't think this training should be taken lightly at all. You know, it's something that we really need to, in fact, everyone needs to participate in it, not just mental health workers, but this kind of training should be done in our religious institutions. Like in the church, you find out that women and even couples are going through marital stress. People are faced with divorce. People are faced with, handling their children, challenges with their children. In the society today, we are plagued with the issue of substance and abuse, drug abuse and substance abuse, and so many issues, business, stress generally in the family, you know. So these are things that with this kind of knowledge, we can actually minimize their effects on our physical health, you know, because once we are mentally helped, or we have that understanding and we manage our mental health, it goes a long way to impact on our physical health positively. So it's been very useful to me, I must say, honestly. My name is Remi Ajayi. I'm not only calling on the government to support this kind of initiative. I'm calling on our religious leaders. I'm calling on our pastors, our imams. I'm calling on parents. I'm calling on proprietors and, you know, heads of schools. I'm calling on even heads of corporate organizations. In some offices today, you find out that colleagues fight amongst themselves. I have the first-hand experience of, you know, while in my office, you know, there was always a colleague of mine who was always lost and everything. Well, I have that heart of compassion. So I could understand that something is not very okay with this person. Something is not right. But I can remember some other colleagues of mine who always just, you know, laugh at her, make fun of her, and call her names. So a lot of times we call people names, but it's not them. Something is happening in their brain. So that's one thing I've learned today, that, see, something is happening there in their brain. So we need to be more compassionate. So I'm calling on every strata of our society to look into this, to continue to replicate this training, you know, to people who handle children in churches, people who handle children at schools, and, you know, generally even pastors. They should undergo this training. Sometimes couples have issues and they're coming to talk to you, and sometimes some of these leaders just feel, oh, we shouldn't let this thing be outblown and all of that. So they tend to cover up things. So this issue of us trying to cover up, we bottle up a lot, and eventually it blows out into, you know, a disease or something. You know, these things can be avoided. So that's what we're learning here today.